Hello, welcome to today's edition of Evolve Rwanda. How have you been? How has the confinement treated you? We're hoping that you are well. We looked forward to this opportunity of bringing to you a conversation with a pharmacist who's also a global health expert. If you have had any questions regarding coronavirus and you didn't have where to find the answers from, then right here is where you ought to stay.
When this virus started, it started in one city, in Wuhan. When it started, the numbers were increasing very fast. They first thought it was not human-to-human transmission. So they thought it cannot be transmitted from one person to another, and they thought it was coming from a certain source, which was sea animals and something like that. Then, as it was increasing in number, so that was considered as an epidemic now. Any disease can become an epidemic in as long as the numbers, the prevalence is increasing very fast, is beyond normal. So it can be considered as an epidemic. Then later, at a later stage, they started seeing this happening in other countries, in other parts, first of all, other parts outside Wuhan, but then it was seen, and I think the first case outside China was seen in Thailand. So when that happened, so people started thinking, so the fact that it can move from China to Thailand, then that means there is a possibility for human-to-human transmission. Even then, it had not been considered as a pandemic, because for any disease to be considered as a pandemic, it has to have the capacity to move across multiple countries. So China and Thailand was not enough to consider it as a pandemic. But when we started seeing a few cases in Europe, then that's when it was declared a public health emergency of international concern. After that, then it was seen in America, then multiplying in a number of countries in Europe, then that's when it was considered as a pandemic. And that's when it was now given much attention. Remember, by then, actually, we were not even calling it COVID-19. By then, we were calling it the new coronavirus, because what was known was it belongs to the family of the coronavirus, because coronavirus has other conditions like the SARS, like the MERS, that have been there before and have been contained before. So it was found to be in that family. So it was called the new coronavirus. Then when it became a pandemic, then there was a need for it to be given a real category and named. So that's when it was called coronavirus, but the disease it causes is COVID-19. That was given a name. Remember, this is completely new. So everything that has happened between December to now is new information. So that's why every day there is a bit of new information that comes out, even from its mode of transmission to how serious it can be. Everything is new information. So science has been learning every bit of it, but it's now considered as a pandemic because it has actually done the spreading than anything before, because it has covered a big geographical area from continent to continent. It has covered the whole world. The measures that we are taking are certainly containing it some, because one thing that we know about this virus is that it is highly contagious. So with its level of spreading, it should have really reached more than 3 million that we are looking at today. So today people have had COVID are only 3 million, where we expect that number to be increasing over time. But in this period, it should have gone more than that if there were no single measures. But what we are looking at is that there is a combination of measures. There's a combination of measures. All these measures that are being used are working hand in hand. So we cannot say there is one silver bullet measure that is going to cap down this disease. So what we need is to have a combination of measures. Don't be surprised if in a few days other measures are coming up. It's because every time we learn about it, then there are new measures. What we learned before was that it was also mutating from one form to another. So if it is moving from one form to another, it might attract another form of a measure. So it is possible that we could be going to have other measures. The virus itself is possible that it can even mutate further. So right now we have seen 2 strains. It can possibly have more than that. Yeah, but the measures we are doing today are helping. They have not been helping 100% because we have not completely eliminated it, but they have helped us from not having it spread to, let's say, 1 billion population. when you look at the management of a pandemic, fast, swift movement, swift decision making is what is needed. Actually, that's where up to date, all the countries that are having a serious burden of this COVID, when you trace about how they imposed measures, you see there was a delay slightly. But by the time every pandemic is declared a pandemic, or it starts showing the signs of being a pandemic, there's always need for immediate decision. And if you see that this pandemic is transmitted through droplets, then once you identify what could be the measure, you need to take it there and then. You don't need to wait. If the measure is to stop movements, do it there and then. If the measure is people wearing masks, do it there and then. The more you wait, the more the pandemic moves, because it is regarded as a pandemic. By the moment it is regarded as a pandemic, it means it can move very fast. So you need to move faster than it. Yeah, you need to act faster than its movement. Everything that comes in people's lives that changes the norms has an impact. COVID on its own has had various effects, socially, spiritually, emotionally, in different ways. Economically, I can't even emphasize that more. There are people who are already affiliated. I could be losing my job. There are people who are having their pay, their salary cut. There are people who are having issues with their families, like you said. There are people having issues with their families. You have to stay with your wife, your husband. Maybe you are not in good terms. You have to stay with your neighbors. Maybe you are not in good terms. You are used to going to bars and meet your colleagues and socialize in different ways. And now this has an impact on people's mental health. There are people who find it a remedy when they go out in bars and talk to and meet their colleagues and come back late at night and sleep and go back to work. There are people who find it as a remedy when they go to work and have their colleagues, that they have their friends. There are people who find it as a remedy when they go out for sports, they go to the gym, they go where. So all these people are suffering in different ways. There are people who are having issues with their businesses. Their businesses are backsliding. They had invested a lot of money. It really has impacted people in different ways. But all in all, people should understand that this is an impact. Recovery phase has to happen. After this, people have to recover. Definitely this will end, but how will it end? How are you planning to have yourself recover? That's what we need to be working on right now. At least what we have seen is that this issue, whenever it enters a country, in a period of at least 45 days, you know the behavior, you know the movement. At least in a period of 45 days, even those countries that were heavily hit, in a period of 45 days, the numbers are no longer escalating, they start coming down. So it actually gives us a sense that in a period of 2 to 3 months, things might come back to normal. But when things come back to normal, which plan are you having to then recover the lost previous months? We need to have a plan. Even if it's business, there needs to be a plan. Even if it's social life, we need to have a plan. Even if it's physical life, whether doing so, there has to be a plan that after this, then life can continue and recover from the lost 2 months. But what we have lost is really remarkable. Yes, let me talk to the corporate world, first of all. There's a corporate world. There are people who will have to benefit from the COVID-19 relief funds that is outside there. There are all those people. And you expect, we don't know how this relief is going to be given to maybe people with various businesses. We have had governments talking about supporting SMEs. I've had government talking about some companies. But we don't know how this is going to come about. Is it going to come in as a grant? Is it going to come as a loan? We don't know. Why not start writing a grant? Why not learning how to write a grant, for example? Learn how to write a grant. You don't know how it's going to turn out. Maybe you need those skills. Why not starting to learn how better to manage finances of a company? There are books outside there that you could be reading that how do you manage small funds for your company? How do you manage crisis in a company, because there's going to be a financial crisis in different businesses. So those are things that you could be doing. Let me talk to people like scholars, for example. There are people, there are students, university students, high school students who are at home. Why not read those new books that you need to read? Why not learn new skills, especially like university students who are dreaming of coming out and starting, going out for work, looking for jobs in a few days? Why then not learn a few skills that you need to employ outside when you are looking for work? Then there are other people in families. Why don't we turn this into an opportunity to learn how to live very well with your family? If you're having issues with your family, use this time. I know there are books that people can read about that, but also there are also behavior changes that you can do to learn how to live with your family. Understand what are the likes of your children, your companion, your spouse. What do they like? What do they need to learn? How can you help them move from one step to another? How can you work on their psychosocial support that you need to give them? All those are things that you need to be doing. Let's not use this time as sleeping, waking up, watching TV and going back. No, look at things that you can do that are really going to give you that strength to feel that you are doing something important in your life and in the lives of your colleagues. Yeah. You can have your role at any level. You could, let me give a small example. You don't want to have 100 millions to give to support to the vulnerable. If you have that, well and good. But the little that you have, if you have 5,000 in your house, you have a neighbor who is about to sleep on an empty stomach. There are people who have been living on hand to mouth and they are not working today. Why not buy them a kilo of maize flour? Why not buy them even like 500 masks? Masks for 500, you give them 3 of them. Then you are helping. In any capacity, you're helping a colleague. Why not make a phone call to your relative, to your colleague, and say, how are you faring in this confinement? Because mental health actually can be treated by small things and can be triggered by small things. Mental health can be triggered by merely spending hours without talking to anyone. So that phone call you receive from your colleague can save you from mental health. That would have been your next disease for the entire life. Just a phone call. You could be calling your colleague and asking them and making that fun, that joke used to make together over a cup of coffee, but that phone call is saving him from an issue he would have had for the entire life. So it's important in every capacity that you can be able to help. Stigma shouldn't be anything to harbor at this age. 2020 is not 1990. We shouldn't look at people who have had this COVID and think their entire life is COVID. These remain human beings. You should not identify them with COVID. We used to have this when we used to identify people with HIV. And we came to learn HIV is HIV, human beings are human beings. So COVID is treatable, is curable. COVID is something that people don't live with for so long. So when people have been healed of COVID, we should look at them as normal human beings. We should have them in our communities. We should have them in our families as normal human beings. They have had their experience of COVID, but life continues, life remains the same. So we should not be having issues of stigma at this era and age. We certainly need people who come out of those to share their stories. Because there are people who have, and these are some of the myths that people have, that in quarantine, maybe people can even get the disease from the quarantine because they are in one place all together. All these are myths, but people who have been there, who have had life there, should come and share these stories. Such that if I am ever in contact with an identified case, then I'm taken to quarantine, at least I'm safe. I know what happens in the quarantine. So we need these people to come out and share their stories. Quarantine, I always say quarantine is not prison. You are not in quarantine because you committed any crime. You are not in quarantine because you have any physical malfunction or anything. You're in quarantine because you are in contact with someone who had this COVID. So people who come out of quarantine or people who were in isolation who had COVID and came back should feel free to share this. It's as if I tell you that 10 years ago I used to suffer from malaria before I started sleeping in a mosquito net. Just remember to put on a face mask to avoid the reinfection, but just feel free. Certainly, this is a new thing that has come to us. It will leave us with new norms. I'm very sure there are things we live with today that we don't know there are new norms because of HIV. Let me use that example. People who lived before HIV could have been living a different life as we do. Let me not go through the details of the new norms of HIV. Definitely, COVID will leave us with new norms. We might certainly live with putting on masks whenever we go to markets, whenever we go into public places. That is going to be a new norm. There are people who are going to do away with pecking and hugging forever. That could be a new norm that is going to come up. There are people who are going to keep on, the new norm is going to be like whenever you are going to sneeze, you are going to use a flex elbow. That's going to be a new norm. Yeah? So there's going to be new norms that are going to come up. And in as long as these new norms are not harming us or harming our colleagues, we are going to live with them. And yeah, that's it. Because COVID is also going to stay somehow. It's a new disease, it's going to remain as a disease, as a known disease. So the new norms are going to happen. Let's always know how to remain hygienic. Because this was a test. This came as a test. We always had hand washing as a scientific statement. But now it has become a real understanding that we need to be washing our hands quite often. We don't know the things we touch. It means that anything else, even if it's not COVID, we are still avoiding it, that would have come by contact. So we need to keep hand washing, whether we still have COVID, whether we don't have COVID, let's keep hand washing and sanitizing all the time. Whether this COVID is eradicated or not, we need to learn how to keep a distance. We need to learn how to behave whenever we are in public. Whenever we are going to sneeze, we need to know how to behave. It might not be only COVID. It might be any other disease that can be transmitted whenever you sneeze in the face of someone. So let's learn how to do all those. And whenever you're in a certain public that you are not trusting of anything, you can put your face masks. It's okay. So these are some of the things that we're advising the public to always do, whether we still have this pandemic or not. Because we don't know when it has to come back. Even if it's eliminated, we don't know when it comes back. But one thing we know about it, it is highly contagious. So it means anytime we are not having a vaccine, we are bound to have it come back. Whether it goes, it will come back, because we shall not have eradicated it. Yeah. COVID might not come to an end as COVID, but this whole situation of fast transmission will come to an end. This is what we need to know. It might not be today, it might not be tomorrow, but this will have to come to an end. There's going to be a time when the vaccine will be available, when the medication will be available. But before then, still life must continue. The reason we have been hit before is because we were in a learning phase. We did not know the behavior of the virus. But now we know the behavior of the virus. Life has to continue. Very soon, I know most governments, most countries are going to open up. Businesses are going to start. Whether the disease will still be around or not, life has to continue. What we need to know is this disease is not deadly as people think. It's not really deadly that whenever you catch it, you die. No. But what we know is it's highly contagious. It can spread very fast. So what we need is to know how to avoid it spreading, but let's remain calm. Let's not have any paranoia that whenever I have it, then I'm going to die. No, we are going to live with this disease until we have the vaccine, and then we can eradicate it.
Thank you so much for watching Evolve Rwanda. As we always say, it is a pleasure. Please do subscribe to our YouTube channel if you have not yet done so. And our hashtag is Evolve Rwanda. And as you heard it from our friend Geoffrey, this pandemic will go and life has to go back to normal. Life is to be lived. So we're not going to be living in paranoia. What do? find a way of coexisting with the virus. Until the vaccine comes, we will not sit there all gloomy saying, no, I am going to die. None of us is going to die. And observe all those measures that have been put in place. You've heard them from Geoffrey. The Ministry of Health keeps reminding us every single day. Let's observe those in order for us to be safe. Thank you so much for watching.